Hello, dear students. Myself, Dr. Gaurav Mukerji, Sage College of Nursing, Sage University, Bhopal. Students, today I am going to deal the topic anatomical movements. So, the general objective of our class is at the end of the class, students will be able to define and describe the term used to describe the movements. First, we'll see what is anatomical movements. So, moving the bodily structure or as the change of the position in one or more of the joints of the body is called as anatomical movements. Joint actions are described in relation to the anatomical position, which is the universal starting position for describing the movements. In the picture, you can see the person is standing in the anatomical position. So, students, why it is important to study the anatomical movements? As the health professional, nurses should have sound knowledge of anatomical movements. It is necessary in order to perform a practical analysis of human movement. Each anatomical movement occurs in a specific plane and around a specific axis of rotation, which is necessary to understand among the students or health professionals. Even though the health professionals or student nurses do the physical examinations of the clients and their patients, they have sound knowledge or adequate knowledge regarding the joints and their structural and functional aspects. So first we will see the movement flexion. The act of bending a joint, especially a bone joint, the counteraction of extension, that is the reverse action of extension, and the state of being bent or flexed or deviation from the straightness. Student, you can see that as the joint bends from the joint, the degree of angle becomes the less. Next is extension. Extension is the opposite of flexion, a straightening movement that increases the angle between the body parts. For example, when standing up, the knees are extended. In the picture, you can see that the flexed hand is going to be straight and the angle from the joint is going to be increased. Third is abduction. In general terms, abduction in the anatomical sense is classified as the motion of the limb or appendage away from the midline of the body. In the case of arm abduction, it is the movement of an arm away from the body within the plane of the torso-sagittal plane. Students, you can see that in the picture that the person is standing straight with the straight hands, and when he is going to move their hand laterally, then it is called as abduction, and the limb is going away from the sagittal plane or midline. Next is adduction. Adduction is the movement of a body part towards the body's midline. So if a person has their arms straight out at the shoulders and brings them down to their sides, it is adduction. For fingers or toes, adduction brings the digit towards the center of the hand or a foot. In a picture, you can see that the limbs of a person is laterally away from the body, and when it is going to be a downward and it is come closer to the midline or a sagittal torso, the movement is called as adduction. Medial. Next is medial rotation. Medial is the term describing closure to the midline. Medial rotation is the rotation of the body part towards the body's midline. So, if a person move their limb or muscle group toward the center of the body is preferred as the medial rotation. So, you can see in the first picture the hand is in a neutral position and it is going closer to the abdomen. Then the rotation is called as medial rotation because the hand is going towards the midline of the body. Next is lateral rotation, that is a reverse action of medial rotation. Lateral is the term describing away to the midline. Lateral rotation is the rotation of the body part away from the body's midline and around the longitudinal axis of a bone. So, if a person move their limb or muscle group away, the center of the body is preferred as a lateral rotation. So, in a picture, you can see that the hand in a neutral position or normal position, it is going to be away from the or move from away from the midline of the body. Next is inversion. So in inversion, the action of turning the sole towards the midline, the sole of a foot moves to face the midline. In the first picture, you can see the normal uh, position of the foot, and when the foot is facing or a sole is facing towards the midline is called as inversion. Next is eversion. Eversion is a reverse of a inversion. That is, eversion is the action of a turning the sole of the foot away from the midline plane. You can see in the picture the normal position of a foot, and in next picture you can see that the foot or a sole of a foot is facing away from the midline. Next is supination. Supination describes the motion of turning the palm anteriorly. Most often, these motions occur with the hands in front of the body to accommodate or grasp and holding types of activities. So, supination is considered turning the palm of the hand upward. For an example, when you are going to take money from anyone, your hand position will be in a supine position. Next position is pronation. Pronation describes a rotational movement of the forearm that results in the palm facing posteriorly when the anatomical when in the anatomical position. When standing up with the elbow in a 90-degree flexion, you can see in the picture the hand in a normal position, and when you turn your palm downwards, it is comes in a prone position. For an example, first you took money in a supine position, and when you put the money in your purse, then it becomes in a prone position. Next is plantar flexion. Plantar flexion is a movement in which the top of your foot points away from your leg. You use plantar flexion whenever you stand on the tip of your toes or a point of your toes. P refers to point. For remembering the plantar flexion, the P alphabet you can also refer as a point. So, in the first picture, you can see the normal position of the foot, and in a second position you can see the tip of a toe is placed on the ground which is called as plantar flexion. Some belly dancers are also use this position for dancing. Next is dorsal flexion, or we can say that dorsiflexion occurs in your ankle when you draw your toes back towards your shins, or we can say that tibia bone. You contract the shin bones and flex the ankle joint when you dorsiflex your foot. You can also dorsiflex your foot by lifting the ball of your foot off the ground while standing, keeping your heel planted into the ground. So, in a picture, you can see the foot in a normal position in the first picture. In the second picture, you can see that the heels of the foot are placed in the ground and the toes are going towards the tibia or shin bone. Our last movement is circumduction. So, students, it is a movement of the limb, hand, or fingers in the circular pattern using the sequential combination of flexion, adduction, extension, and abduction motions. Adduction, abduction, and circumduction take place at the shoulder, hip, wrist, metacarpophalangeal, and metatarsophalangeal joints. So, for example, when we are igniting the sparkles in the festival and your hands are moving in a circumduction movement, you can also refer the video for the movement. Thank you, students. I hope you learned much more. Best of luck for your bright future. Thank you.